Most people think they know what really harms their heart and blood vessels. Things like high cholesterol, high blood pressure, a poor diet. And yes, those things do matter. But what if I told you there's another factor that you might overlook every single night, something that could quietly raise your risk of heart attack by 20% if you ignore it? It's your sleep, or rather, the lack of good restorative sleep. The truth is, chronic sleep deprivation can damage your cardiovascular system more than you might realize. In this video, I'm going to break down exactly how your sleep quality directly impacts your heart, your blood vessels, and your overall cardiometabolic health. And I'll share one critical fact at the end that could help you protect your heart starting tonight. So stick with me because the last fact might surprise you. I'm Dr. John Chuback, and I'm a board-certified cardiovascular surgeon. Let's get this thing started. Poor sleep raises blood pressure. Let's start with that first problem, blood pressure. When you're sleep deprived, your body ramps up production of stress hormones, mainly cortisol and adrenaline, which you may also know as epinephrine. These hormones raise your resting heart rate and make your blood vessels tighten or constrict. When that happens, night after night, your blood pressure doesn't have a chance to come down and rest the way it should. So instead of your heart resting at night, it stays under constant pressure. Over time, that chronic strain leads to hypertension or high blood pressure, which is one of the biggest risk factors for heart attack and stroke. So if you struggle with high blood pressure and you're not sleeping well, fixing your sleep could be one of the best things you do for your heart. Sleep affects body weight and metabolism. Now, poor sleep doesn't just affect your stress hormones, it messes with your hunger hormones too. When you don't get enough sleep, hormones like ghrelin, which makes you feel hungry, go up. At the same time, leptin, which tells you you're full, that hormone goes down. And that's why people who are sleep deprived often crave processed, high glycemic foods, sugary snacks, fast food, empty carbs. Over time, that leads to weight gain, especially around the belly, which puts more strain on your heart. More body fat means more work for your heart to pump blood through that extra tissue. It raises inflammation, increases your risk for blocked arteries, and it all ties back to how well you sleep at night. Let's talk about sleep and inflammation. Poor or fragmented sleep increases inflammation in your body, which is bad news for your arteries. One of the markers we look at is C-reactive protein, or CRP. When CRP is elevated, it tells your body it's under chronic low-grade inflammation. This type of inflammation damages the lining of your blood vessels, what we call the endothelium, and it accelerates the buildup of plaque inside your arteries. On the other hand, deep restorative sleep is when your body repairs itself. It lowers inflammation and helps your blood vessels stay flexible and healthy. So better sleep literally helps your arteries heal overnight. Let's talk about cardiac arrhythmias and sleep. Cardiac arrhythmias and sleep disorders are linked, especially obstructive sleep apnea, or OSA for short. OSA is when your airway gets blocked during sleep. You stop breathing for short periods, which drops your oxygen levels and forces your body to jolt you awake, sometimes dozens, even hundreds of times a night. This stop and start pattern puts massive stress on your heart. It spikes blood pressure repeatedly during the night, increases your risk for cardiac arrhythmias like atrial fibrillation, which can lead to stroke and heart failure if left untreated. OSA is more common than you think, and many people don't even know they have it. If you snore loudly, if your partner notices you stop breathing or gasp for air during the night, or if you feel exhausted even after 7 or 8 hours in bed, these are big red flags that there might be sleep apnea going on. Untreated moderate to severe OSA can significantly raise your risk of congestive heart failure, so don't ignore it. Good sleep protects cardiac function. So what happens when you do get good sleep? Most adults need 7 to 9 hours of continuous deep sleep for optimal heart health. During deep, slow-wave sleep, your sympathetic nervous system, the fight or flight system, naturally quiets down. Your heart rate drops, your blood pressure drops, and your body gets a chance to rest and repair. Think of it as your nightly reset. It lowers strain on your heart, helps your blood vessels recover. If you're skimping on sleep, you miss that reset and the damage quietly adds up over time. Here's my doctor's tip as a cardiac surgeon. If you snore heavily, feel very tired during the day, despite spending enough time in bed, or if your blood pressure stays high no matter what you try, talk to your doctor about a diagnostic sleep study. A simple sleep study can detect apnea or other sleep issues, and getting treatment can lower your risk for heart disease dramatically. Sometimes fixing your sleep does more for your heart than even other medications. My most important takeaway from today's subject is that research shows that people who routinely sleep less than 6 hours a night have up to 20% higher risk of heart attack to those who get 7 or 8 hours. So protecting your sleep is just as important as eating well, exercising, or taking your medications. And if you suspect obstructive sleep apnea, please don't ignore it. Untreated apnea can double your risk of serious heart disease over time. So tonight, give your heart what it really needs: deep, restful sleep. Your arteries, your blood pressure, and your whole body will thank you for it. If you found this helpful, please share it with someone you care about. Drop your questions below. I read every single one. And don't forget to subscribe for clear, trustworthy medical advice you can use to protect your heart and your life. I'm Dr. John Chuback. Thank you for watching, and I'll see you in the next video.